All right, it is 3 o'clock. So in the interest of time, because we've got a lot to cover today, I will turn it over to Linda to get us started.
Welcome, everybody. This is our fourth presentation of our Primary Prevention of Intimate Partner Violence series. We are really excited to have Marty Liccardo join us again. He was with us last week when we started on our second goal of our programming, which talked about men engagement, cultural and social norms. We have 5 primary prevention areas that we're trying to work on this. The first one was the impact of healthy and unhealthy intimate relationships and the prevention of intimate partner violence. Dr. Franchek did a wonderful job of outlining that, and we do have links to these videos that we'll make sure to share. We started last week with Marty Liccardo. Marty has been working at the Utah Department of Health. He is a men's engagement specialist and works on the prevention of boys and men in the prevention of violence. As we continue on, in November, we'll be using language and communication with our patients and community members, then leading into institutional policies, so what's happening in your workplaces and within your communities. And then finally, we'll have prevention resources available at the local, state, and national level. We have no disclosure format today. Is we're going to have a 15 to 20-minute presentation from Marty, and then we will break up into small breakout groups, and a facilitator will help mentor discussion and hope we can have an engaging conversation.
Happy to be back and excited about this conversation. I have a decent amount of material to cover today and not a great amount of time, so I'm going to be moving pretty quickly. I will let you all know that I would prefer to do this in more of a dialoguing format. That is not happening today. I'm going to be covering a lot of broad-based ideas associated with how we engage and talk to men about violence prevention, and my hope is it spurs a lot of discussion. I will also tell you some of these ideas within the field I work in men's engagement, are controversial. You may find them not controversial at all. You may be really annoyed with me, some of the things I'm suggesting, but my hope is it spurs good dialogue and discussion. I've been working in men's engagement, in violence prevention for 22 years and in men's engagement for about 18. And this is a bit of a culmination of things I've learned that work and don't. I always like to start, and I said this last time for those who are joining again, like 98% of rape and sexual assault is committed by men. Did I just say that 98% of men rape? I did not. I don't believe they do. Most men don't. Most men are wonderful people. Some of my best friends are men. I'm a man myself. So it's not a criticism of men, except to say men make up a grossly disproportionate number of the people perpetrating this crime, which makes this a men's violence issue, not a women's issue. That's the problem. That we've been focusing on this as a women's issue when really men can be victims, men can be perpetrators, women can be victims, women can be perpetrators, but there's something going on with the percentage of men who are committing the vast majority of these crimes. And even if it's an isolated group of men, we're going to talk about why, even though men commit the majority of these crimes or are responsible in many cases for them, men as an identity marker, maleness as an identity marker, do not feel accountable or responsible at all. We're going to talk about why that is today too. Just like last time, just like last week, today is the curiosity. Okay, we should have more questions and answers at the end of this. I'm not going to make this easier. It's going to be more complicated. We should have some ideas that are new or at least shifted perspectives on today, and we should begin with some small amount of action steps, and I'll talk to you about that as well. Masculinity is neither a good thing or a bad thing. Usually I like to ask this question. We have a big discussion about what's good and what's bad. Not today. Masculinity is a broad-based cultural concept. There are components of maleness. We have long, drawn-out conversations about the difference between gender and sex. We have long conversations about what is maleness or masculine, what is just a concept of masculinity in general, which isn't applied to gender. It's very complicated. And part of the problem here, too, is that when we talk about masculinity, or especially as we talk about violent masculinity or toxic masculinity, some of the terms I'll go through in a few minutes here, we oftentimes men, especially male-identified folks who have not thought a lot about this issue or thought a lot about gendered binaries as being incomplete, they start to equate you saying that maleness is bad or they are bad, and we'll get into that as well. But masculinity is neither a good thing or a bad thing. There's great things that come out of masculinity. There's great things that come out of concepts of femininity. And I'll also tell you, as a person, there are things that I identify as male or masculine, and there's things that are, my beard has taken me a long time to grow in, and this is something that's important to me, right? It's an identity marker for me. This doesn't make me violent. This doesn't make me non-accountable for men's sexually aggressive behavior or my inappropriate behavior. These kinds of ideas are complex. So what we want to do is make sure that the people we're targeting or tackling with this issue understand that. This is also one of those big concepts I like to get out of the way right at the beginning. Male privilege, male supremacy, and toxic masculinity are all things that exist and they're a problem. But one of the problems when we use these terms and talk about these terms is these are structural cultural issues. When we talk about male privilege as a concept, white supremacy or toxic masculinity, these are structural drivers to how we function in our society, how human beings function. And when we apply I've had many men in presentations early on when toxic masculinity began to be used say, so you saying that because I'm a guy, I'm toxic. So unpacking that a little is really important. And I find these terms not very useful when talking about individual behavior. And for those of you who were here last week, we talked about the social ecological model. When talking about individual behavior change or community behavior change or societal health behavior, when we're thinking about those things, talking to individuals about these concepts is really, really challenging. And additionally, you can't say that a guy is not acting out his privilege. That's a misreading of how privilege works. If they are, they're doing something generally discriminatory, which is a broader and more different problem, which I'll talk about in a second here. But these terms in general, I don't like using these when talking to individual men or about individual behavior, because these are more structural issues. They should be talked about. We should talk about how they function and play a role in our culture and how we need to challenge them and change them. But when talking to individual males, they're not useful terms. Male privilege is a set of privileges given to men as a class due to their institutional power in relation to women as a class. While every man experiences privilege differently due to his own individual position in social hierarchy, every man, by virtue of being read as male by society, benefits from male privilege. That's important. Men do benefit from this. Even if there's intersectional identities that are not privileged, men still benefit from male privilege in a variety of ways. White privilege works in very similar ways. However, as we move on to the next section, privilege is very complicated. How do we discuss privilege and equity when individuals don't experience privilege in the same way as others experience oppression? Privilege is unobserved and often unexperienced by those who have it. So this concept is really critical in understanding how do we start this conversation of, if we're talking about violence prevention and we want to start to talk about men's accountability, men's behavior culturally, individual men's behavior in general, we need to start with the understanding that men don't experience their privilege in the same way that we experience male privilege culturally. It is unobserved and often unexperienced. They don't notice it or see it. So it feels more like an accusation when it's targeted. And for those who work in health education, stigmatization and being called names and being accused of things is not a good beginning to motivation for change, especially for someone who, if you know the trans theoretical model or stages of change model, it's not a good starting point, especially for people who haven't started thinking about this issue. In a nutshell, most men don't see rape and sexual assault, sexual violence, stalking, domestic violence as their issue, because they don't see themselves as perpetrators. When they don't see themselves as perpetrators, this doesn't seem like it's important to them. They also don't see themselves as people who can experience violence. Men don't have the same cultural risk. This is an area of privilege. Oftentimes, a partner who identifies as female says, you're really lucky you get to go out and run at night. You don't even have to think about how dangerous that is. And it's true. It's not just that I don't think, oh, it's safer for me as male. That's really nice. It's that I don't even consider my physical safety or security as an issue when nighttime happens. A lot of women do. And there's a variety of different activities you can do to illustrate that. But this is an area of privilege, but it's unobserved. I don't put my running clothes on and think, man, it's good to be a guy. So glad I'm not a woman. Right? And I hope we understand the differentiation there. I'm not suggesting it's okay. I'm not suggesting male privilege is okay. Frankly speaking, if we're allegedly fighting a war on terror right now, I'm all for it. I hate terror. Maybe we need to work on domestic terrorism because women in our communities are afraid to go out at night, which should be not okay to anybody. But that's another point and another presentation. Okay. Most men don't perceive themselves as part of the problem or that this problem even exists for them. And what we need to change our focus and efforts towards men as change agents. So if you want to get men engaged, because they don't see themselves as rapists or potential rapists or people who are even progressing a society where we promote ideas of violence against women, since they don't see themselves that way, the way to actually engage these men is looking at them as change agents. How can you say, no, you can be a part of the solution? This is also in some ways bolstering this idea of like, you can be a hero and you can be a helper, which men like in general. And again, by the way, I do realize that I'm making these grand sweeping statements about gender in general, but it's important to start thinking about how we want to start engaging people in this work. And we want to invite men in as a group and not bar them. Okay. Also, in general, it's also difficult to be male, like individual males. My nephew called me like a year ago, and he was 16 years old at the time. And he said, Uncle Marty, I have a real problem. He said, right now, I just realized that I was slut shaming a friend of mine really badly with my friends at my high school. And I feel really bad about it. This is a good thing, by the way. When I was in high school, the term slut shaming didn't exist for me. I didn't know what that was. I am sure I actively participated in dehumanizing people in my high school for a variety of identity reasons. This was a very difficult situation. He then said to me, but the problem, Uncle Marty, is I'm getting more popular by doing it, and I don't know what to do. Now, this is a moment where some people would be like, oh, that situation is so easy. Just stop slut shaming this girl and stop being mean to her. However, if we go back to high school and understand the importance of social structure and hierarchy there, this was a difficult thing for him to navigate. And so we actually spent about 2 hours on the phone talking about how he could navigate through some of these barriers without harming his reputation, how he could challenge his friends without that harming him. It was a difficult thing to navigate. And I name this narrative because we often act like clearing these situations up is easy, but relational interactivity, community connection, social hierarchy, these are messy concepts culturally. So we need to be aware of that. Navigating adolescence hard, being set up for failure. In many cases, patriarchy hurts men in many similar ways and different ways than it harms female identified people or queer people or in general. So that patriarchy is bad for everybody, including men. Feeling targeted in general about this, whether it's real or perceived. I've had many men in the last few months after Time's Up and Me Too started say to me, you can't say anything to women these days. Now, that's a silly statement, right? Of course you can say things to women. My point here is that that's how they felt. And how they feel in terms of engagement is actually a critical thing to think about. I don't think we need to remove accountability. We'll talk about accountability in a few minutes, but this is where this stuff starts to get tricky. And additionally, cultural policing. I know some of the best young men I've ever met and young women I've ever met do some pretty heinous things because they were goaded into it, or who would not normally have made poor health choices in general. I think of cigarette smoking too. No teenager wakes up one day and thinks, you know what I want to do is light up a nice cigarette this morning with my cup of grapefruit juice. This is one of those social cultural things that gets built into, and usually there's a cultural bullying into it. And then this turns into an addictive behavior or a pattern or a habit that needs to be shifted. Okay, the way to think about this is not focusing on men as the problem, but focusing on the problem. Men and boys as active solutions. How are you participating knowingly or unknowingly in the problem behavior or in the protective behavior? Remember, we talked about risk and protective factors last time. What are opportunities and protective factors you can bolster? What are opportunities for harm you're actually participating in without knowing it? Are you silently sitting by while somebody slut shames because you say something because you have clout or power in that organization or community or group that could be beneficial? Okay, what are barriers to engagement and what are opportunities to help others? Things to think about. Okay. What doesn't work is you're the accountability and responsibility, like men feeling attacked. And again, this is one of those areas I worry that people are like, you're going easy, you're being too soft on men. I don't feel like that's the goal here. Once men are engaged, you can then start talking about accountability and responsibility in a much deeper way when they feel connected to these issues. Men don't see themselves as part of the violence, so they don't see themselves as connected to it. Men believe many of the social norms and myths surrounding sexual violence, and we can talk about that in general in terms of like when women drink, they get held accountable. They're responsible for their behavior. When a woman dresses really sexy and flirts, what does she think happens? These are common rape mythology, things that are not true about sexual violence that a lot of people believe that we reinforce culturally and socially. So we're working with people who are inundated with these mythos and these social norms that are problems. Why do we do men's engagement? Because violence harms men more often than it harms women. To be perfectly honest, men are more often harmed by violence than women are in this culture. When we look at statistics and information, the difference though is they're harmed by men too. That like we are all victims of men's violence, and which is why we need to think about this in a broadly different way. So I already said 90% of rapes are perpetrated by men. More than half of all stalking cases are perpetrated by men. Almost all lethal domestic violence and dating violence cases are perpetrated by men. Violence against women is mostly a men's issue. However, there are consequences for masculinity and men in general, which is men's health is poorer than women's. Men die younger than women do. Men take greater risks. Men have greater issues with substance abuse than women do statistically. When we talk about suicide ideation and suicide. Men commit suicide more frequently than women do. So this is one of those things that we need to start thinking about, that understanding that men have a consequence, and maleness and toxic masculinity, however we want to frame this, harms men too. My approach in general, so in a nutshell, this is where the way I think we need to start rethinking about men's engagement. It should be a public health approach using the socio-ecological model and risk and protective factors. We talked about those in some detail last week, but looking at both individuals, relationships, communities, and society, and looking at what are risk factors, things that make people more likely to be perpetrators or victims of violence, and what are protective factors, think that make it less likely to be a perpetrator or victim. I'll tell you, the big shift in violence prevention work right now is we're reframing the focus of this work on perpetrator prevention, not victim prevention. We've been focusing on victims for the last 40, 50, 2,000, 10,000 years with sexual violence. We need to start looking at perpetration. Who's doing this and why? And that reframe shifts a lot of this discussion when we talk about prevention. We need to be strength-based, focusing on what you should be doing, not what you shouldn't be doing. We need to look at a social norms approach, bystander intervention, look at media literacy, and then mindful masculinity. How are you using masculinity to support your health and wellness and the health and wellness of your family, community, relationships, and society? And how is some of the masculinity harming you? You know, one of the things I often talk about too is that, like, when we take risks, oftentimes, especially ones that are violent, why do men drink and drive more than women do? Like, even these kinds of risks, oftentimes it's you can hold your liquor, like these cultural norms and mores that need to go away, that change. And the problem right now with a lot of these social norms is we're seeing women attached to hypermasculine norms. We're not seeing the opposite happen, where men are taking less risks. So we need to shift in that way. Cultural competence, cultural humility. I went into this in a lot more detail last time, but how does this function in communities with dominant identities? What about communities with dominant, subordinate, intersectional identities? And I want to go into some detail on this too. When we talk about intersectionality, in a lot of the work we do, we tend to focus on the intersections of multiple identities, but they tend to be subordinate identities. And what I want to talk about is, how do we start to look at dominant identities and subordinate identities together, that you're working with people who have both, that a person can be white, they can be cisgendered, they can be heterosexual or heteronormative in their thinking, they can be part of a predominant religious affiliation depending on where they live, middle to upper class, able-bodied, conventionally attractive, but they could also have subordinate identities. And how do these things work together? How do we start to really broaden what intersectionality means and talk about it in complicated ways? I guess what I'm saying with this is, like, when you're working with men, understand that we tend to have this attitude of, like, you're a white heterosexual male, you've got the world ahead of you, like the world is your oyster. But a lot of those men don't feel that way. I will also say the group committing suicide or completing suicide, actually effectively committing suicide the most right now, are 45-year-old middle-class white folks, white men. Okay, that is the largest population of people killing themselves right now. So what I'm saying here is, the world is really complicated, and how we talk about it, especially with people who don't feel like they have this perceived power, but keep being told they have it, you butting heads. These ideas are butting against each other. So how can we invite broader conversation while still talking about accountability? You can't do a don't. This is a statement somebody made to me, and I thought it was the greatest thing I've ever heard. We must define what is healthy if we're going to tell people what to do, that if we're going to tell people what isn't healthy. We have to educate on what is healthy if we're going to educate on what's not healthy. We must do research on what is healthy if we're going to do research on claims that are unhealthy. And what I mean by this in general is, like, telling men what not to do, it has to be followed up with telling them what to do, with helping them to live in healthy relationships, how to balance community and work, how to understand how fiscal responsibility and health look. That, like, we have a lot of criticisms culturally and socially all over the place, but we don't have a lot of bolstering. This is that strength-based approach I was talking about before. How do we use this to our advantage? But you can't do a don't. You have to follow up any kind of challenge or criticism with valuable information on what you should be doing and how you should be doing it, or at least a conversation about it. Again, when I talked about this a minute ago, but when we talk about risk and protective factors for sexual violence, we need to be focusing on what makes a person less likely to be a victim or a perpetrator, and a person more likely to not commit violence and to have healthy. I already talked about social ecological model, and we talked about social norms in general last week as it relates to men too, understanding that most men, most women, most people, most humans will, given the right information and the right environments, make healthier choices. And we need to trust and believe that people will do that. But we have other ways that social norms activities can be incorporated. When we talk about substance abuse, mental health, physical activity, health behaviors, bystander behavior, environmental health, all of these are areas which actually challenge hypermasculinity and toxic masculinity and support healthy communities. So when we talk about social normings, let's remember that when we don't necessarily have to talk about maleness or toxic masculinity to be actually doing men's engagement work and healthy community work and violence prevention work. Looking at a public health approach means that we don't necessarily, I'm going to say something mildly controversial right here. We don't need to talk about consent to do violence prevention work. And if you told me that 20 years ago, I would say that's crazy. You have to talk about consent. You don't. When talking about healthy relationships and healthy communication, you don't need to do this hard push on consent every time to get a conversation going about what consent looks like and how people communicate and adding these components in. That we tend to focus on what isn't good instead of what is, and we need to shift that thinking a little, especially when we talk about primary prevention. And again, bystander intervention in general is a primary prevention and public health approach to a safe and healthy community, and intervention before, during, and after a person witnesses harm, violence of a group, another person, group, or community. So basically, when you see something bad, harmful, negative, awful, we want people to engage in that and try and prevent that, stop that, interrupt that behavior. That's bystander intervention. And this right now is probably the best approach we've seen to primary prevention in general. Primarily, bystander intervention is one of the better approaches, not just because it's a good skill to learn in general, but because it's both education, which is important, but then it's skill-based and application of those skills in one educational training. And some of us today, we might have a chance, but I know you went through some scenarios with Dr. Frenchek last week. These are good skills building opportunities, and bystander intervention is a good way to start interrupting some of these precursors to violence, especially as it relates to challenging hypermasculine behavior and toxic masculinity. Understand that what we're doing right now, especially with people you're working, especially with adults, is an unlearning behavior. You are unlearning these things that they have been taught and reinforced and society has pounded into their heads for their whole lives. So understanding that when we talk about rape culture, health, or social norms, it starts with an unlearning or a challenging, and then we need to retrain and teach what it means to do a healthier, different choice. I'm going to end on these kinds of topics. Somebody once said to me, after listening and talking about men's engagement in a different way, I have a new empathy for men's defensiveness. I now have a better understanding of why men might be defensive. I hope you take that away from today. The defensiveness isn't okay, and the accountability needs to be there, but having broadening our empathy for why men might be defensive or why this might be a hard concept for people to immediately grasp. And so how we have to carefully navigate these conversations. Vulnerability and resilience as an action behavior. Vulnerability is a skill, it's a muscle, you need to train it. Resiliency is a skill and a muscle. You need to work on it. This is not just something people do, it's something people develop and build and hone. We should have a grandma and grandpa rule. When grandma says something racist, we don't scream at her and tell her she's the worst person in the world and she needs to get herself right and here are these 10 books she needs to read. We sit down and we say, Grandma, that's not an appropriate thing to say. That might hurt people's feelings, or we should talk to people in different ways. Same rule applies, I think, culturally and socially. We need to be kinder in our approaches. Kindness as a radical act, especially when working with men, but also talking about difficult and troubling issues. Privilege is structural and societal and not individual. That's the last thing I want to get at. That when we talk about privilege, understanding that it is structural and not individual, and how do we differentiate privilege in that way from talking about individual behaviors that need to be shifted or changed. And finally, what does accountability look like for violence? We're going to talk about this in these small groups in a minute here. So I'm going to let somebody's got some of these questions, but how do we talk about individual accountability, interpersonal accountability, and society accountability for men and for women and for people who identify as non-binary or gender variant? How do we talk about accountability? Because men are responsible for things, certainly, and male privilege exists and white privilege exists, but also we as a culture still condone a lot of these ideas. And so how do we start to hold ourselves accountable in that way too? And also, how do we forgive ourselves the transgressions while we move towards being better people? Because that is important too. What would real accountability look like for prevention of violence? I don't know. These are good, broader questions I hope we think about. And in general, I always like to give people some goals of thinking about that. But I think the next few minutes of discussion will shed some light on that.
Like you talked about, Marty, you want to leave people a little bit confused. You want everybody to go out and start these conversations and have them with the group. And So that was kind of the point of these breakout rooms and these breakout sessions, is to just kind of whet everybody's appetite and get it going. So
Well, and I mean, I love that narrative too, because it underscores where is our defensiveness coming from? Where does mine come from when someone disagrees with my notion that, like, you know, men are the problem? Where is my defensiveness coming from? And like this notion of like curiosity as a muscle is really important too. That how do we practice going, help me understand how you think the way you think, because you got there somehow. It's not like, I mean, I always love, like, you know, when talking to very young people or high school or college age students, I now find going like, you weren't born woke, right? Like you didn't like just you came into a context in which you learned all of these things. And a lot of people before you didn't have an opportunity to, because we didn't teach them. So like, these are, again, so you can have empathy there, but at the same time, you also get to challenge people who do harm. And I think we do need to understand it's just, the world is these issues are so much more complicated. And I think we are a pattern seeking primate that likes to simplify things, and trying to make that more complicated gets difficult. How do we make this a more fun exercise to learn from each other instead of like automatically going into hostility? Because again, I always like that reminder, most people want to do the right thing. Most people want to help each other. Most people, I do believe that, with evidence, all the evidence to the contrary. So,
all right, fantastic. We are after 4 o'clock, so I want to respect everybody's time. Reach out for any questions. This is just kind of hitting the tip of the iceberg. It's very broad. And our hope is once we are finished with this portion of our education and training, that we can delve in deeper. I want to thank our breakout mentors for joining us today and sharing with us your expertise. And hopefully we will see you guys all on October 6th for our next session. Thanks, everybody.